Alrighty, good afternoon. My name is Peter Tater. I lead the communications department here at Sarasota Memorial. I wanted to thank you all for coming out, especially on short notice, for this important update on COVID-19 in our community. And I'm going to hand you right over to our President and CEO, David Veranda. Thank you.
Thank you. Good afternoon. It's great to see you all again. Thank you, Peter, and thank you for all of you joining us today. The health of our community is a top priority for us all, and we appreciate the important role you all play and the challenge in keeping people informed during this rapidly evolving situation. Joining me today is I have our Chief Medical Officer for Sarasota Memorial, Dr. Jim Murica. Jim. We have Emergency Medical Specialist, Dr. Joel Gerber. We have Dr. Manny Gordillo, who we are very happy to have back today. As many of you know, he was Dr. Gordillo first diagnosed the very first patient here in Sarasota County with COVID. We are also happy to have Chuck Henry representing us today. Chuck, and Dr. Jack Rodman, who is Vice President and Chief Medical Officer for Physicians Group in town. As you know, we announced our first presumptive positive case last night. A 70-year-old man from Massachusetts who's a Sarasota resident, a seasonal resident of Sarasota. He was one of 2 Sarasota County patients who received presumptive positive results last night, and I'm happy to report to you he is doing well. While the virus is not expected to cause severe illness in the majority of the infected people, we do not want to minimize it. SMH has been preparing for this eventuality for more than a month, and we have trained teams equipped with the resources needed to help keep the community safe. I'm happy to report that because of these protections that were put in place, we have fewer than 24 employees who are considered low to no risk of exposure. There were no other patients or visitors in our hospital considered at risk. As more people are diagnosed in the region, it is important to remember that we are all talking about more than numbers. These are people that we care for and care about, and we all need to do our part to prevent the spread of this virus and protect those the most vulnerable in our community. It's hard to believe that just 2 weeks ago we gathered in the same room to talk about the region's first case and the need for doing more testing. We knew COVID was in Florida and would soon arrive to our community. Well, now it's here, and testing remains one of our biggest challenges. Overall testing capacity in our state and around the U.S. is growing, but not fast enough to keep up with the public demand. 3 public hospital labs in Florida are running 7 days a week. Turnaround time for these results is typically taking 48 hours. As of today, Sarasota Memorial has sent nearly 146 samples for testing. 85 are negative, and we have 1 presumptive positive. The rest are still pending. It's important to understand that there are no local hospitals, urgent care centers, or physician offices in our region equipped to test for COVID-19. And so testing remains focused primarily on hospitalized patients and those at higher risk. Vulnerable people such as the elderly or those with underlying health problems, as well as people who develop symptoms after being exposed to the virus through travel or contact with other infected people. We are working with LabCorp of America and Quest Diagnostics and existing vendors in the hope to offer COVID-19 testing through the SMH laboratory in the near future. But it's important to understand that testing is not available at this time for people with mild symptoms who have no known exposure. We realize you have many questions, and we will take them all in a few minutes. But for now, I'd like to invite Chuck Henry from the Health Department to share a few tips on precautions people can take to protect themselves. Chuck?
Chuck. Thank you, David. And really, I want to start out by just recognizing Sarasota Memorial and the other healthcare hospitals in our region, as well as all the healthcare providers, for the incredible work they're doing for our community. They really are the front line in the face of our efforts in this national emergency at the local level. So we really appreciate their partnership and their help in this. I'll keep my words relatively short, but what's most important to me for everyone to know: first, we all need to remain calm and work with the facts that are out there. We encourage people to check the Florida Department of Health website for credible information, as well as the CDC, the Centers for Disease Control and Prevention's website. Those are the two credible sources that we ask people to check. And the reason we drive them to the website is the information is updated regularly and changes. And so it's important that we pay attention to that, because if we put out printed material, it might be outdated the next day. In terms of what we can do as a community and what we can do as a family, the most important thing is to control those things that you have control over. So I encourage people to wash their hands thoroughly, at least 20 seconds. If hand washing isn't available, use hand sanitizers, at least 60% alcohol content if you can find it out there. Stay home if you're sick. I can't stress that enough. This would apply when you have influenza or a common cold, but especially now with COVID-19. If you're sick, you should isolate and stay home and not expose others. So I think those are the messages we want to continue to drive home. Those are things that we all as citizens have control over, thinking about how we go about our daily lives and work, and making sure that we're protecting not only our community but our family. We all have vulnerable individuals in our families, and we don't want to expose them unnecessarily to illness. Thank you.
Okay, we'd like to open it up for questions.
Can you tell us about that other Sarasota County resident?
I'm going to show.
Individual who has tested positive.
Sure, this is the second positive that was reported last night. We have a little bit of information. In fact, that individual is listed right now as a Sarasota County resident. They are not in Sarasota County physically. They haven't been here, as I understand, since late December. So from a public health and epi investigation standpoint, that's not something we're digging into. They traveled all over the U.S. and recently returned to Florida, and I understand they're in a hospital in Broward County. But the case is reported based on residence, so it shows up as a Sarasota case.
Do you know is this a travel-related case, and what specific travel exposed this patient to the coronavirus?
So I don't have all of those details. It's my understanding they've not traveled outside of the U.S., although traveled extensively in the U.S., and that's what I know at this time.
Can you tell us how many people approximately in Sarasota County have been tested overall?
I don't disclose the numbers of local testing. We as a state aggregate those numbers on our state website, and that's specifically because in smaller counties we're concerned about people's individual privacy.
So I'm sorry, you have one patient who is not currently in Sarasota, but because they're a Sarasota resident, they're reported as a Sarasota case. Does this hospital have a case now?
We
Yes.
have one presumptive case.
There were two presumptive cases reported last night, one that is in this hospital, one that's in a hospital elsewhere in the state, but reports a residence in Sarasota.
And are you now tracking that 70-year-old individual who is here as to where they have been in the community and what exposure other people might have had to that individual?
Absolutely. So our standard epidemiological procedure for any infectious disease that's transmittable is to understand the contacts that person may have had during the infectious period of that disease, and to reach out to all of those individuals, interview them, and make sure that we're taking the right protective measures for the community.
Let me ask you, because I think this is a question for you rather than some of these other healthcare professionals. There have been a number of events canceled, and I've seen on social media there's a lot of people who are saying it's an overreaction, it's a media blown out event, and there's no real harm to the community. What would you say to those individuals who don't think that there is any risk in exposure to this?
Well, I would say, number one, this is a serious illness, and we can all look at the news reports from around the world and see things that are happening. Fortunately, not here in the U.S. completely at that level. It is something we should pay attention to, and we've been working really hard, the public health world, to do case containment, meaning identifying cases, identifying those contacts, making sure that we're taking protective measures to stop the spread. It's at some point, as we've seen across the world, becomes community transmission that begins to occur, and it's not just people that have traveled, and there could be well people that are transmitting it that have milder cases. And so out of concern for that, we begin to shift towards community control. One of those things is avoiding what we call large events. And so whatever number you want to put on the event, our message is if you're an individual in a risk category, meaning you're over 60, especially if you have underlying health conditions, if you have underlying health conditions for any age, you should probably avoid large events at this time, because we don't have a handle on where this virus may be or who may be sick. And so that's just good advice all the time. And we can help control and slow down the spread of this virus by implementing these community controls.
From a public
Chuck,
health
have you been able
standpoint,
to
does it
determine
make
if your
sense?
70-year-old here at the hospital is a travel case or a local case?
We're still in the middle of that investigation. We believe that individual is a part-year resident, and so we're still tracking all that information down.
What is the process like when you go about trying to track his movements to see where you have to go and tell people that they came in contact with this man before he was admitted here?
We use every tool available to us to try to do that, because our goal is to identify anybody that was in contact with that individual going back to the incubation period for that disease. So in this case, usually that's 14 days prior to when the onset of symptoms was.
Can you talk about that patient? When did he, well, we know when he came into the hospital, but what were the signs and symptoms that he was already?
I'm sorry, I can't talk about individual patient information. I can certainly talk about the investigative process, though.
Do we know, has everyone who he was in contact with prior to coming into the hospital been notified, or will people still be being notified?
You know, this is an evolving event. We first got word late yesterday. Teams worked through the night and this morning. And so I know they've contacted the majority, but we're still combing through all the data to make sure we haven't missed anybody.
The health department keeps urging people to not make contact if they are showing symptoms or if they don't feel well, try to stay home and self-isolate. But in the absence of testing, there's a period of time there where you may be contagious, but you're not exhibiting symptoms. And I sense some of the frustration from the hospital that we simply don't have enough testing going on. What's being done to change that so that people who are concerned they may have been exposed but are not yet exhibiting symptoms can get a test so that they don't infect more people?
So I hear two questions there. One is about testing capacity, and the other is the message for individuals. So let me address individuals first. We encourage anybody that is ill to contact their health provider if they have a respiratory illness or a fever, and have that discussion before they go in. I would give this recommendation whether COVID-19 was out there or not, because we don't want individuals with influenza or other illnesses sitting in waiting rooms potentially infecting other people. So contact your healthcare provider, get instructions on where you can be seen, how that can happen. If the healthcare provider refers you to the health department, we will try to work with them to determine whether or not they fall into the risk category to pull into testing right away, or if they're well, our best advice for people is, just like with the influenza, self-isolate, stay home, and recover. You know, one of our big concerns through all of this is overwhelming our healthcare system. And while we have a fabulous system here in Sarasota County, it can still be easily overwhelmed at a time like this. So if people don't need to be in the hospital and don't require medical care, then their best move is to stay home and isolate. Certainly they should contact their provider. Certainly they can contact the hospital and ask questions, and we will do our best to inform them. And in terms of the testing question, more and more, every day we see a larger capacity moving. The federal government is working. Our governor announced yesterday that they had gone out and purchased a number of tests that they're distributing around the state. Some of the national labs, as you heard from David, are coming online. Quest and LabCorp. And so as those come online and they're ramping up their capacity, I think over the coming days and weeks, we'll finally get to that testing capacity we want. But you know, that's where we want to be ideal, and we're just not quite there yet. So until we get there, we are doing our best to identify those individuals that need contact with the healthcare system, to monitor their health or to be admitted and make sure we know their status, because that's really important in terms of protecting our healthcare system so that we stay open and available for everyone.
Can you please clarify the criteria that someone has to meet in order to be tested in the state?
So I will do my best. I guess I'll give a caveat that we look at that criteria and it's adjusted as tests become available. But as of right now, certainly anyone that's a known contact of someone that's having symptoms, someone that has traveled to the designated areas, Category 3 areas as CDC calls them, and the number of countries there grows every day, that comes back and then becomes ill. So those are people we're tracking that have self-isolated or been told to isolate that then become ill. So they're priority testing. Anybody that has an upper respiratory infection, or lower respiratory infection, excuse me, that is of unknown origin. So we've looked at all the potential causes and we're not sure still why it's there. Then we want to test them and make sure it's not COVID-19. So those are the big categories that we're prioritizing and making certain that we get those individuals tested first.
Now, I know when we spoke 2 weeks ago, the hospital really wanted to prioritize outpatient testing. Is that starting to become available, or is it still really just these hospitalized patients that are being tested?
So I think it is slowly becoming available, but there's a number of things that have to happen for the community-wide testing that people think of. The supplies have to be out broader in the medical community. The training for those providers on how to do samples and the space for them to do that, as well as knowing where to send them to for sampling. So LabCorp and Quest coming online will be a huge help. They're national labs. They're standing up additional testing sites all over the nation and ramping up their capacity. And so I believe shortly we'll be able to send tests to them right away, as well as all of our public health labs. And we continue to have capacity at the public health labs to ensure that we cover those that most require testing.
Can I ask a question to Dr. Gordillo? We know that your self-quarantine has ended. How does it feel back with what
That's
you're
a great
doing?
question.
We talked about this last Friday. You kind of felt like you were out of the game, but now you're thrown right in the middle again.
Well, it feels great. This is what I wanted to be. I thought I was useful at home a little bit with this great team right here and the rest of the staff. But this is what I want to be. So I'm delighted to be here, and I'm delighted to be talking to all of you.
What is the procedure now for hospital staff, physicians, anyone who comes into contact with a patient? Because yesterday we heard from Hillsborough County that first responders would take off their gear, their clothing, red bag it, and try to minimize contamination. What does the hospital do?
Well, we have we follow the CDC guidelines for all of this, and the CDC guidelines have been updated fairly frequently, and we're keeping up with that. So right now we follow what they recommend in terms of personal protective equipment, and there is a constant evolution of this. As the pandemic progresses, we adapt to that, and we follow whatever the CDC is recommending. So there's a certain PPE, what we call personal protective equipment, that CDC prescribes, and that's what we go by. What you describe is outside the CDC recommendations, and those are kind of unique circumstances, but not what's prescribed by CDC or recommended by CDC.
Although the hospital doesn't have the ability to test, you guys have collection kits to collect the actual swabs sent off for testing?
Yeah, we do. As David said, we've done a large number of tests. This is the first one that came back positive. And there's still a number of them that are pending. So the hospitals can send tests, and our hospital sends a lot of tests, as a matter of fact. The problem is in the outpatient setting, and this is a problem that they've been describing already.
How much more testing would be ongoing under ideal conditions?
I don't know that we know that.
Well, we don't know that, but yeah, I can tell you, it will be a large number, but it's just speculation.
Has there been any change with billing in reference to these tests, or how is that being treated at this point?
You went out now? We're just following our normal prescribed policies on billing, but it's not something we've had a whole lot of discussion about. We're just trying to process. It's important to remember that all the patients that have been tested at the hospital are people who have been have needed to be hospitalized for some reason. Okay, so and these patients have come in here. I'm sorry about the construction. These people have come in here and they are screened or eliminated for other reasons. So they rule out influenza, rule out a number of other viruses, and then they become eligible to be tested for COVID-19. So these people are already in the hospital. So when you talk about billing, that's going to fall under their Medicare reimbursement or their reimbursements we have with their insurance companies.
You indicated there were 60 tests or so still outstanding. The state, as of last night, said that there were 147 pending test results statewide. Is there a disproportionate number of outstanding tests here, or is that just not up-to-date information? How does that
It's hard to understand. I don't really know where the state numbers come from. I do know where our numbers come from, and we have I think 60 people that are outstanding right now. Some of those have been sent off already to the labs in Tampa to be tested, and some of them are waiting for the lab to pick it up or us to deliver it to the lab. So it's a constantly moving number. We always have tests going in and out.
to get people coming to this hospital, right? I mean, they could be here for a broken arm or something like that, but when you speak to them, they're like, oh no, they have a case here now, you know, I'm nervous about that. Can you offer some words of reassurance about how it is that you're handling these cases and how separate they are from everybody else, as to give people confidence about still coming to the hospital?
Yeah.
That this is a place where there is a patient who's presumptively positive?
So I think we do a very good job of screening, and I may let Dr. Gerber here talk a little bit, because he's running the ER, and that's where patients come through, right, if they're coming to the hospital. But we're doing a great job in the ER screening patients, of getting them into kind of a respiratory illness issue or other issue. And if you go into the respiratory issue, then you start getting more screening questions, and you're immediately, you know, put in either isolation, some form of isolation, or certainly protective equipment, mask, and that type of thing. We have not heard I have not heard people expressing a lot of concern about being in the hospital and having other respiratory patients here.
Is it like sealed off in some way, or is it, you know, just so that they know that there is a way to try to prevent it from being?
Well, the patients are, to the extent, it depends on the level of illness that they're showing, and through the algorithm, and they're either taken to isolation, but they're certainly put in mask and everything else per the CDC guidelines, and we are, I think people are very protected.
How does that seem being handled for folks that are not in the hospital? Because throughout the state, we have seen some cases that there are individuals that are not hospitalized, that are in self-isolation. Are the Department of Health collecting these swabs and sending them off to be tested?
Want to answer that, Chuck? Yeah.
So yes, for individuals in our community that are in self-isolation or mandatory isolation, depending on the situation, that become ill, part of that process is, depending on their risk category, we're talking to them either daily from the health department, or every 3 days, or they're very low risk and they're just asked to report to us if they become ill. But if the illness occurs, then we evaluate that, and sometimes we'll go out to their home and test them. Sometimes they'll come to the health department and we'll test them, but they become our responsibility to ensure that testing happens with those individuals that are then become symptomatic.
Dr. Gordillo, we are sending some stuff up to Telemundo, so if you wouldn't mind talking a little bit in Spanish about what the status is of this patient here at Sarasota Memorial.
No puedo darle muchas recomendaciones, quedarme en detalles del paciente por razones de privacidad, pero la persona de aquí del hospital le pueden dar un pequeño resumen, pero yo personalmente no puedo hacer eso por razones de privacidad.
I have a question for the health department. Do hospitals and emergency services have enough respirators if this gets significantly widespread?
So we continue to monitor resources across the health system, and where there appears to be concern about stocks, we report those up to the state. We have, with the governor's emergency declaration, the state EOC is open, so we have both the health side and the state emergency response side that we can funnel emergency requests for information up to make sure we have equipment to take care of our patients.
So what's next for this individual?
Question for David?
Yes.
Some hospitals have told their staff that if they've traveled in the past 14 days to some of these designated areas within on a cruise ship, not to come to work. Is this affecting any kind of hospital staffing?
Well, we've certainly put a travel moratorium throughout our staff. We have 7,200 employees, 1,400 doctors, and 600 volunteers. And we have put a travel moratorium for any business-related travel and canceled every big group thing that we can find. And if someone does present and is in quarantine, we are asking them not to be here, obviously.
But you haven't experienced any kind of issues with hospital staffing at this point?
We have not at this point, no.
So what's next for this individual? How are you guys going to treat this individual, and what's going to be the process on how to ensure, I'm sure these doctors, nurses are going to be treating other people as well. What do you guys do to prepare when you leave that individual to see other people?
I can answer the second part of that, and one of these, and Jim, you want to do the whole thing?
Yeah,
okay.
Go ahead. Happy to.
Doctor.
Say your name, please.
My name is Dr. James Murica. I'm the Chief Medical Officer. Yeah, so what happened with this patient? I was notified by Dr. Gordillo that this patient had a presumptive positive test yesterday, early evening. We're at the end of a medical staff meeting, so there were several physicians with me. We went separate. And two of us, actually three of us, went to the patient's nursing station. We actually, we notified the patient and family. The hospitalist taking care of the patient notified the patient and family. I went ahead and notified the nursing staff at that point. And obviously a command center was called, a meeting was called. We reviewed the process. We isolated, the staff actually worked very well. They worked overnight identifying any potential contacts that this person was exposed to. Also, I have to say that the nurses, I have to be proud of the staff because we spent many weeks preparing for a potential patient that was positive, and no one wants to have a positive, but our system actually worked very, very well. There were very minimal to no changes that occurred. There was minimal to no disruption on that floor to the nursing staff. They were all committed to making sure everybody was safe, and it worked very well, and we were proud of that. And we continue to look for potential contacts that may have been exposed and work with the health department. It worked very well.
Did any staff have to enter self-isolation because of the positive?
That's being evaluated right now. Right now, as of today, there's minimal to no risk.
Can we answer for you, Jim?
Absolutely,
okay.
That'd be great.
So we have asked 16 staff. We've identified 16 staff members that we've asked to go into self-quarantine at this point, while we evaluate what exposures they may or may not have had. We don't expect any, and that's going on right now. And then they'll be released from that as we have assurance that they don't have any type of exposure.
So treating someone, the doctors, nurses, what protocol is there so once they're done with that man can go off to another individual in the hospital and treat them?
Sure, I'll talk to it, but these guys are the better experts to that. So our nurses and all of our staff have been very well trained on how to handle isolation procedures. So they literally gown up and gown down walking into a patient's room. It's a very prescriptive, a very orderly process, and one that we take very seriously. So our staff is very well trained in that and are abiding by all the precautions. Any other questions?
Thank you all for
Okay. Can I say one thing else? All right, I'd like to just follow up. I want to thank the members of the media for taking an interest in this. I think it really is important. I said that in my opening statements. I'd like to reiterate that. I'd like to also thank our 7,200 employees here who are rushing towards this problem and are putting themselves out there to help this community and help the people that are in need. Our 1,400 physicians, all I do is get phone calls from them asking, can I come in and can I help? And our 600 volunteers are saying, no, we won't go home. We want to be here. We want to help. So everybody in this organization is reaching out and doing what they can for the benefit of this town, this region, and we all owe our providers here a great debt of thanks. So I appreciate your time, and I appreciate you taking an interest. Thank you.